Night terror is something that happens in the toddler years, elementary school, maybe even a little into middle school. So a night terror tends to be more in the beginning of the sleep cycle, so during non-rem sleep. So it's going to happen about an hour and a half or so after they've fallen asleep. It tends to be pretty brief because they're thrashing about in their bed or yelling and screaming. Night terrors can be caused by genetic factors. It tends to be more inheritable. Family members will have had those experiences. They can be brought on if a kid is overtired, if they are having some stressors in their life as well. Also, medications can bring on night terrors. If your child is walking around and having a night terror, you can gently guide them back to bed, get any hazards out of their way. You can talk to them. It's just important not to try and wake them up. Get them back into their bed. The best way to stop night terrors as a parent is to make sure we always have very good sleep hygiene. That means having a very nice bed routine. Oftentimes that includes like a bath time, brushing teeth, reading a story. It's really important to get away from screens at least an hour or two before bedtime. It's not good to have screens in the bedroom. And also keeping waking time at a very consistent level or time, making sure they're just waking up at the same time every day, no matter what the night looked like. I think it's important to talk with your pediatrician about night terrors if they're not following the typical patterns. For example, if they're lasting too long, or if the child seems especially out of it, if you feel like they're being unsafe, if you feel like there might be any seizure activity, or if there might be any breathing issues, then those are certainly things that you can talk with a pediatrician about. Also, if there's any thoughts on maybe there could be a link to depression or anxiety, which can happen especially in the age of COVID-19. There's a lot of very anxious kids out there. Absolutely come in and see your pediatrician if you are concerned about any night terrors or nightmares. We can talk you through those types of scenarios and give you pointers and make sure everything is okay with your child.